can take the rain on the roof of this empty house. That don't bother me. I can
Welcome back. Foxy, I guess, is going to join me for this one. Like the title says, it's about post-traumatic stress disorder. And, yeah, I'm going to read from my research, and I guess she's just up here to go after the mic cord. Stop. So you can laugh for her and listen to me. It's a great combination. Alright, right into it. Post-traumatic stress disorder, also known as PTSD, develops after a terrifying ordeal that involved physical harm or the threat of physical harm. The person who develops PTSD may have been the one who was harmed. The harm may have happened to a loved one, or the person may have witnessed a hurtful event that happened to loved ones or strangers. A great example of this is rape, or even with soldiers, combat. Potentially harmful situation. They feel that, sorry, lost my train of thought, is officially derailed. They can develop post-traumatic stress disorder. Actually, PTSD was first brought to public attention in relation to war veterans, but it can result from a variety of traumatic events, such as mugging, rape, torture, being kidnapped or held captive, child abuse, car accidents, train wrecks, plane crashes, bombings, or natural disasters such as floods or earthquakes. People with PTSD may startle easily, become emotionally numb, especially in relation to people with whom they used to be close, lose interest in things they used to enjoy, have trouble feeling affectionate, be irritable, become more aggressive, or even become violent. They avoid situations that remind them of the original incident, and anniversaries of the incident are often very difficult. PTSD symptoms seem to be worse if the event that triggered them was deliberately initiated by another person, as in a mugging or a kidnapping. Most people with PTSD repeatedly relive the trauma in their thoughts during the day and in nightmares when they sleep. These are called flashbacks. Flashbacks may consist of images, sounds, smells, or feelings, and are often triggered by ordinary occurrences such as a door slamming or a car backfiring on the street. A war veteran would probably be very susceptible to a car backfiring if their PTSD is the result of combat. That'd be a great example of that. A person having a flashback may lose touch with reality and believe that the traumatic event is happening all over again. Not every traumatized person develops full-blown or even minor PTSD. Symptoms usually begin within 3 months of the incident, but they may occasionally emerge years afterwards. They must last more than a month to be considered PTSD. The course of the illness varies. Some people recover within 6 months, while others have symptoms that last much longer. In some people, the condition becomes chronic. PTSD affects about 7.7 million American adults, but it can occur at any age, including childhood. Women are more likely to develop PTSD than men, and there is some evidence that susceptibility to the disorder may run in families. PTSD is often accompanied by depression, substance abuse, or one or more of the other anxiety disorders. Certain kinds of medication and certain kinds of psychotherapy usually treat the symptoms of PTSD very effectively. You going somewhere? I guess you are. But yeah, let me think. PTSD, best thing I can really advise is get therapy. It helps to talk. I'm really making myself a hypocrite by saying it, because I never talk about my feelings or anything like that, really. But yeah, it hurts to talk about it, but you know something? It helps. It helps a lot. In the books I've been reading, the Kildare series by John Ringo, Mike Harmon has flashbacks about. In the first book, he has flashbacks about the hostage situation in Syria. Note that these books are fiction, please. There was a hostage situation in Syria that he had to rescue 50 girls, and one of them died from being tortured for 2 hours, raped by 12 men, and basically they just killed her as slowly and painfully as they possibly could. Except for the killing part that they did. Yeah. But he has flashbacks in that book from the night that incident in the bunker. Later in the last book of the series, he has flashbacks about the one he loved, Gretchen Mahona, who was killed during a I believe it was a resupply drop in a combat situation. And basically the situation was he loved someone he could not have, and then she got blown all over the inside of a helicopter. And he went on a 2-month bender, and for those of you who do not know what a bender is, it's basically a period where you get continuously drunk, and yeah, you're just using a substance to run away from something else. He experienced nightmares about Gretchen, had flashbacks about her. Everything reminded him of her, had a painting made so that he could remember her, yada yada. Just an example that I pulled out of my ass there. Sorry about the language. I guess that's pretty much it. If you think someone you know might have it, talk to them about it. They may not want to talk about it. Recommend a psychologist if you know one. I can offer advice, but I am not a psychologist as of yet, obviously. If you have any questions, please ask. I will do my best to answer them. And of course, any feedback you have, it's much appreciated. Give a shout out. I apologize, I do not remember your name off the top of my head. But I give a shout out to my first subscriber, and young lady who actually has panic disorder and also wants to become a clinical psychologist, and I also wish you luck in that. I can tell you that looking forward to being in school for about another decade is not something I'm actually looking forward to. I'm looking forward to the end result, though. So hopefully I can do the best job I can, and yeah. Probably the next video I do will be over social phobia, or social anxiety disorder, excuse me. But yeah, I will probably make that soon. I might just make it after this. Who knows? I guess you'll know. Keep watching. Again, all feedback is great. I appreciate it. Probably return the favor. Until next time, keep it up. Stay tuned.